Hello friends, let's today talk about reasons behind scoliosis. Scoliosis in simple sense is sideways tilting of the spine. Now, there are multiple reasons behind scoliosis, but today we are going to discuss about three most common reasons. First is the idiopathic scoliosis type. Idiopathic scoliosis stands for the scoliosis where there is no exact underlying reason, but this runs in the family. That means it has a genetic influence. Like it could be there in the grandmother, then from her it could pass on to her daughter, and then it can pass on to the third generation, where again it is more commonly seen in females. So idiopathic scoliosis for some reason is more common in females. It is usually detected during the growth spurt. That means in females, normally it is noticed between 10 years to 15 years. The growth spurt in females happens usually around the age of 11 years to 13 years. It is a painless type of scoliosis normally. The first noticed symptom is unequal or uneven shoulder level. That means one shoulder is up, other shoulder is down. Secondly, unequal waistline can also point towards scoliosis. That means one hip is up, other hip is down. Also, sometimes we see a rib hump. Rib hump becomes more prominent as the height progresses or when we reach near the puberty. Second type of scoliosis is congenital scoliosis. This type of scoliosis is basically present since birth. It is because one vertebra is either missing or partially formed or fused, or it is of unequal shape like a butterfly vertebra also. So there is always some underlying bony pathology in case of congenital scoliosis. This is present since birth, but it is almost never noticed before the age of 4 or 5 years. And after that, this curve rapidly progresses. Sometimes the curve is very rigid, you cannot even correct it with your manual pressure with your hands. Or there may be underlying other organ related pathologies also, like kidney problem or heart related problems. Third type of common scoliosis is neuromuscular scoliosis. This is because of weakness or imbalance between the muscles and the nerve on either side of the spine. This is more commonly seen in situations like polio or cerebral palsy or muscular dystrophies. Rarely it can happen after spinal cord injury also. In this situation, normally it is a C-shaped curve. That means the curve resembles the C alphabet of English dictionary. The features of this type of curve is they are normally long curves involving the entire spine. The patient will have very poor control of the trunk. Sitting imbalance may be there, patient may be wheelchair bound. These curves normally rapidly progress and they often involve the pelvis or the hip part also. So these are three most common type of scoliosis. Other than this, there are other sorts of scoliosis which are rarely found, like adult onset scoliosis or syndromic scoliosis that happens in conditions like Marfan syndrome. Sometimes it is a non-structural scoliosis, which is because of limb length discrepancy or poor posture also. So if you are suffering from scoliosis, don't worry. Meet your doctor, and whatever is best possible treatment for you, your doctor will advise you. All the best.